Ever notice your cat just isn't quite themselves? Maybe a little more sleepy or a sniffle that just won't quit.
Yeah, happens all the time.
We often just, brush these things off, maybe hope they'll pass. But sometimes they can hint at something. Oh, something more significant.
It's true.
So today we're doing a deep dive into cryptococcosis. It's a fungal infection, and it can affect our beloved cats and dogs.
Exactly. Cryptococcosis is caused by yeasts, basically fungi, from the Cryptococcus family. The main ones are C. neoformans and C. gattii.
Right.
And you can think of these as tiny invaders that can cause either a localized infection, like just in one spot, or they can spread through the whole body.
Making it systemic.
Systemic, exactly.
Now, you might be listening and thinking, okay, but why should I care if I don't have pets? Well, understanding how things in our environment can impact health, even our pets' health, it sort of gives us a bigger picture.
It really does. Environmental health affects us all.
And if you do have a furry family member, then this is really critical information. What really jumped out at me from our sources was just how much more common this whole thing is in cats.
Oh, it's a striking difference. Yeah, the data shows cats are like 7 to 10 times more likely to get cryptococcosis than dogs.
7 to 10 times. Wow.
Yeah. In fact, it's the most common systemic fungal infection we actually see in cats.
Ah,
So our goal today is really to break down the key facts about it, look at how it affects our furry friends, and just give you the information you need to be aware
yeah.
without getting totally bogged down in super technical medical jargon.
Perfect. Okay, let's unpack this then. Where do these fungal invaders actually come from? What's the source of the problem?
Well, C. neoformans, that's one of the main culprits. It's pretty common in the environment. You find it particularly in places with lots of bird droppings, especially pigeons, and also in decaying plants.
Okay.
And when soil in those areas gets disturbed, digging, construction, even strong winds, it can aerosolize the spores, releasing them into the air. That increases the risk.
So disturbed soil is a key factor there. What about the other one, C. gattii?
Right, C. gattii is a bit different. It's more associated with certain trees, especially eucalyptus tree.
Eucalyptus. Interesting.
Yeah, and because of that association, we see more infections with C. gattii in specific places. Think parts of Southern California, areas in Australia, and even up on Vancouver Island in Canada.
So there's a real geographical link with that one.
Definitely. It shows how the local environment, the types of trees even, can play a direct role.
So, okay, the spores are in the air, maybe from bird droppings or near eucalyptus trees. How do our pets actually get infected then? They just breathe it in.
That's the main way, yeah. Inhalation. Breathing in these microscopic yeast cells is the most common route.
Right.
And this usually leads to the first infection starting right there in the nasal passages. It's like the fungus sets up its first base camp in the nose.
Makes sense.
It's less common, but sometimes the organism might get inhaled deeper, right down into the terminal airways of the lungs, or potentially even enter through the gut if ingested. But inhalation is really the big one.
And once it's, say, established in the nose, how does it manage to spread to the other parts of the body?
Well, it can spread through the bloodstream. We call that hematogenous dissemination.
Hematogenous. Bloodborne, basically.
Exactly, bloodborne. The fungus essentially hitches a ride in the blood. Some of the body's own immune cells, called macrophages, can actually pick up the yeast, say, in the nose, but then inadvertently carry it elsewhere.
Oh, so the immune cell's trying to help actually spread it.
Kind of, yeah.
Yeah.
They carry it to various organs. The brain is a big one. Also, the eyes, lungs, and even the skin can be affected this way.
Wow.
And besides spreading through the blood, we also see it spreading more locally. Like from the nasal infection, it can move directly to the skin around the nose and eyes, and also to the nearby lymph nodes, the ones that drain that facial area.
That really paints a picture of how something starting in the nose can end up causing problems all over.
Yeah.
Now, we already touched on this, but cats are way more susceptible, right?
Massively so. That 7 to 10 times figure is really significant. Cryptococcosis is the most common systemic fungal disease in cats. Full stop.
Okay. So being a cat is the biggest risk factor. Are there others, like certain breeds?
Yeah, beyond just species, there do seem to be some breed predispositions, maybe more so in dogs.
Oh, which ones?
Our sources mention breeds like American Cocker Spaniels, Great Danes, Doberman Pinschers, and Boxers seem to pop up more often. And for cats, there's a suggestion, maybe less strong, but a possibility that Siamese cats might have a slightly higher risk.
Interesting. What about age? Is it mostly older pets, pets with weaker immune systems already?
Actually, it's often seen in younger animals. Typically under 4 years old is kind of the peak
Oh,
time.
younger. That's
Yeah.
surprising.
It is a bit counterintuitive, yeah,
Yeah.
but it absolutely can occur at any age. We even see documented cases in puppies under 6 months old. So age isn't a complete barrier.
Okay.
And one other little note, some data suggests male cats might be slightly overrepresented, slightly more common in males.
So, okay, if we put it together,
Mm,
maybe a young male Siamese cat who loves digging around outdoors, that could be a sort of higher risk profile.
potentially, yeah. That paints a picture based on the factors we see mentioned.
Right. So if you're listening and starting to feel a bit worried, maybe about your own cat or dog, what are the signs? What should people be watching for?
Well, the signs can be really varied. It totally depends on which organs the fungus has decided to invade.
Makes sense.
And they often don't just appear overnight. They tend to develop quite gradually, sometimes over weeks, maybe even months.
Okay, so slow onset. What about in dogs specifically?
For dogs, neurological signs are actually pretty prominent. Things like seizures, uncoordinated movement, they might look really wobbly or unsteady. That's called ataxia.
Ataxia, right?
Yeah. Or just weakness in their limbs, paresis. Eye problems are also common in dogs swelling around the eyes, or even blindness, sadly. And skin issues like sores or ulcers.
Ulcers. And
Then you can also see things like swollen lymph nodes, maybe vomiting and diarrhea. Those are maybe a bit less specific.
got it. And cats. You said it's much more common in cats.
Yeah.
What are the typical signs there?
In cats, it often starts with the upper respiratory system, so a persistent nasal discharge is a really big one. Sneezing, noisy breathing.
Okay, and nasal signs.
Yep. Eye signs are also common in cats, affecting various parts of the eye. And neurological signs, too. Seizures, again, maybe disorientation or balance problems. They might tilt their head or walk in circles. Those are called vestibular signs.
Vestibular, like inner ear or balance issues.
Exactly, related to balance. And a really sort of characteristic thing we see in cats is the development of what's called granulomatous tissue, often right at the nostrils. It can look like firm swellings, almost like bumps on the bridge of their nose.
Ah, that distinctive swelling on the nose.
Yeah, that's quite suggestive in cats. They can also have swollen lymph nodes, like dogs. Less commonly, cats might show actual lung issues, like coughing or difficulty breathing, but the nasal and facial stuff is usually more prominent.
So, a really wide range of symptoms hitting the nervous system, eyes, skin, respiratory tract. Yeah. Are there any general things a vet might pick up during a physical exam that point towards crypto?
Yeah, definitely. During an exam, a vet might find a mild fever, though not always. In dogs, they might note things like poor appetite, that nasal discharge we talked about, the neurological deficits, maybe signs of inflammation inside the eye.
Okay.
In cats, common findings would be that increased respiratory noise because of the nasal issue, maybe those ulcerated or crusty skin lesions, often on the head or face, enlarged lymph nodes, and again, those neurological or ocular signs.
It really sounds like putting the pieces together can be a challenge, given how many different ways it can show up.
It absolutely can be.
So what actually makes one animal get sick while another, exposed to the same environment, might be fine? Is it just bad luck encountering the fungus?
It seems to be more of a combination. It's about, yes, exposure to the Cryptococcus organism, but critically, it's also about the animal's immune system and its inability to effectively fight it off.
Ah, the immune system response.
Exactly. So while exposure, maybe digging in contaminated soil where birds hang out, is a necessary first step, a robust immune system can often contain or eliminate the infection before it takes hold or spreads.
Right.
And we see this really clearly in cats. We know that underlying conditions that suppress the immune system, especially infections like feline leukemia virus, FLV, or
Right.
feline immunodeficiency virus, FIV, those significantly increase a cat's risk of developing clinical cryptococcosis if they get exposed. Their defenses are already lowered.
That makes total sense. A compromised immune system just can't handle the invasion as well. So, okay, a vet suspects crypto based on the signs, maybe the history.
Yeah.
What's the diagnostic process actually look like? What are they trying to pin down?
Well, you're right. Because the symptoms can mimic so many other diseases, the first step is often ruling other things out. It's called differential diagnosis.
Right. The differentials.
So for dogs, depending on the signs, they might need to consider other neurological diseases, different kinds of nasal tumors or inflammation, lymphoma, which is a cancer, or even other types of fungal infections like aspergillosis or blastomycosis.
Okay.
And in cats, the list might include things like nasal tumors, chronic rhinitis, or sinusitis, just long-term inflammation, various skin infections or skin cancers, lymphoma again, FIP, feline infectious peritonitis,
That's always tricky.
always, and even toxoplasmosis. They can all present with somewhat similar signs, so you really need specific tests to confirm crypto.
And what are those key specific tests? What gives the definitive answer?
The absolute cornerstone of diagnosis is usually a test that detects the cryptococcal capsular antigen.
The antigen test.
Yeah. It's typically done using methods like latex agglutination or ELUSA. These tests look for a specific part of the fungus's outer capsule, its signature, you could say, in either the animal's serum, the liquid part of blood, or sometimes in cerebrospinal fluid, CSF, if there are neurological signs.
And CSF is the fluid around the brain and spine.
Exactly. And these antigen tests are generally very sensitive and specific, meaning they're good at finding it if it's there and not giving false positives.
Good.
Plus, the level of antigen detected, the titer, often correlates with how severe or widespread the infection is. Higher levels usually mean more infection.
So it gives you an idea of the burden of infection.
It does. Although it's worth noting the test might be slightly less sensitive in some dogs compared to cats. And sometimes a low positive might just indicate colonization, like the fungus is just sitting on a surface. But higher titers strongly suggest active infection.
Gotcha. Are imaging techniques like X-rays or CT scans helpful too?
They certainly can be. If a cat has nasal signs, standard x-rays of the nose might show soft tissue swelling inside the nasal passages, maybe some bone destruction if it's advanced.
Okay.
But for a really detailed look, especially at the brain or deeper nasal structures, or if there are neurological signs, then advanced imaging like CT or MRI is much better.
CT or MRI for the head stuff.
Definitely. Chest x-rays are usually only done if there are specific signs pointing to lung involvement, like coughing or breathing difficulty, which is less common, especially in cats.
And what about actually seeing the fungus? Getting a sample?
Oh, absolutely crucial. Getting samples for cytology, looking at cells under a microscope, and for fungal culture is really important to confirm things.
How do they get those samples?
Depends on where the signs are. If there's nasal discharge, they might collect some of that, or take fine needle aspirates, using a needle to suck out cells from swollen lymph nodes or any lumps under the skin. Biopsies, taking small tissue samples, are often needed for skin lesions or those nasal swellings in cats. Sometimes, if a cat has severe nasal blockage, the vet might need to look into the nasopharynx, the area behind the nose, maybe with an endoscope, to find and biopsy those fungal masses, the granulomas.
Okay.
And sending these samples for fungal culture, trying to grow the fungus in the lab, is key. Not just to confirm it is Cryptococcus, but sometimes they'll also do sensitivity testing on the culture.
Sensitivity testing to see which drugs work best.
Exactly. It tells you which antifungal medications are most likely to be effective against that specific strain the animal has. That can be really helpful if the first treatment choice isn't working well.
That makes sense. So once it's confirmed, what does this infection actually look like, pathologically speaking, inside the body tissues?
Well, on a macroscopic level, like what you might see during surgery or a post-mortem exam, the lesions often appear as these sort of gray, gelatinous, slimy masses.
Gelatinous. What?
That's largely due to the fungus's thick outer coat, that polysaccharide capsule we mentioned. It gives it that texture. In cats, you typically find these masses in the nose, the sinuses, and the nasopharynx. Skin lesions often look like ulcers or nodules.
Okay.
In dogs, neurological lesions are more common, maybe diffuse inflammation or distinct fungal growths, called cryptococcomas, within the brain or spinal cord. And eye involvement, like inflammation in the back of the eye, chorioretinitis, retinal detachment, or optic nerve inflammation can happen in both species.
And if you looked closer, under a microscope.
Microscopically, you typically see what's called pyogranulomatous inflammation. That's basically a mix of different immune cells, like neutrophils and macrophages, trying to wall off and fight the fungus.
Okay, the body's trying to fight it.
It's trying, but sometimes the inflammatory response can actually be quite minimal. That thick capsule around the yeast can really hinder the immune cells, sort of shield the fungus.
So the capsule is protective for the fungus.
Very much so. And the yeast cells themselves look typically round or oval. They're surrounded by that clear capsule halo, and they reproduce by budding, specifically narrow-based budding, where a daughter cell pinches off from the parent. That capsule is really a key virulence factor, helping it survive in the host.
A very sneaky and well-defended little organism.
Mm-hmm.
Okay, let's shift to treatment. It sounds challenging.
Oh.
What are the main strategies?
Generally, treatment can often be managed on an outpatient basis, meaning at home, unless the animal has severe neurological signs that need initial hospital support.
Right.
A really important point, especially for cats with nasal obstruction making it hard to smell or breathe, is encouraging them to eat. Using highly palatable, maybe strong-smelling soft foods can be critical to maintain their nutrition.
Good tip. And the medications. What drugs do vets use?
The mainstay of treatment is antifungal medication. Fluconazole is very often the first choice, particularly if the eyes or the central nervous system are involved.
Why specifically for eyes and CNS?
Because it's water-soluble and penetrates those tissues really well, better than some other options, it gets into the brain and eyes effectively. Plus, it's usually given orally, once or twice a day, and tends to be the most economical option too.
Okay, fluconazole is common. What else?
Itraconazole is another widely used one. It usually comes in capsules, and it's really important that these are given with a fatty meal.
Why with food?
It needs the fat to be absorbed properly from the gut. Without food, especially fatty food, you just don't get good drug levels in the bloodstream.
Yeah,
There are also some palatable pellet forms available now, which might help with giving it.
that's useful.
One caution with itraconazole, though liquid versions made by compounding pharmacies can have really variable, often poor absorption. So generally, the capsules or licensed formulations are preferred.
Good to know. Any other drug options?
For very severe life-threatening cases, sometimes vets will use amphotericin B. This one has to be given intravenously, usually in hospital, and requires really close monitoring of kidney function because it can be quite toxic to the kidneys.
Okay, so Ampho B is for the really tough cases.
Right. And then there's terbinafine. This drug has shown good effectiveness, especially for infections that might be resistant to the azole drugs like fluconazole or itraconazole, particularly in cats. It's sometimes used in combination therapy, too.
Are there other important things owners need to know about treatment?
Absolutely. Client education is huge here. Owners need to understand this is typically a chronic disease requiring potentially months and months of medication. It's a big commitment.
Yeah, setting expectations is key.
Exactly. And it's also really important to reassure them that cryptococcosis is not considered zoonotic. They are very unlikely to catch it from their sick pet. That's a common worry.
That's a relief for owners, I'm sure.
Definitely. A couple of other points. Sometimes, if there are large fungal masses in the nasopharynx blocking airflow, surgical debulking might be considered to help them breathe better. Also, steroid use should generally be avoided, as steroids suppress the immune system, which is the opposite of what you want.
Right, no steroids.
And owners need to be aware of potential drug side effects. The azole drugs, fluconazole, itraconazole, and terbinafine can potentially affect the liver, so monitoring liver enzymes with blood tests is important. We already mentioned kidney monitoring for amphotericin B, and itraconazole can occasionally cause a specific type of skin reaction, an ulcerative dermatitis.
Lots to monitor. And what if the first drug doesn't work? Can the fungus become resistant?
Yes, unfortunately, resistance can develop. If an animal isn't responding as expected, or if their antigen levels aren't dropping, resistance might be the issue. That's when sensitivity testing on a culture becomes valuable, or the vet might empirically switch to a different drug class, maybe bringing in terbinafine, or even considering IV amphotericin B.
So treatment is definitely a marathon, not a sprint, it sounds like.
Yeah.
What about follow-up care? How do vets track progress?
Regular rechecks are absolutely essential. This involves monitoring the pet's clinical signs. Are they breathing better? Are the skin lesions healing? Are neurological signs improving? And also repeating blood tests, particularly to check liver enzymes early in treatment with the azoles or terbinafine.
And that antigen test you mentioned for diagnosis, is that used during treatment too?
Yes, definitely. Monitoring the cryptococcal antigen titer is key for assessing response. After about 2 months of effective therapy, we'd expect to see that titer decrease significantly, often by at least 2 dilutions or fourfold. If the titer isn't dropping, or if it starts to go back up, that's a concern. It might indicate treatment failure or maybe resistance, like we just discussed. We usually check the antigen levels every, say, 1 to 2 months throughout the treatment course.
And even after treatment stops?
Yes, it's recommended to continue monitoring the titer even after stopping the medication, maybe every few months initially, then less often, to watch for any relapse or recurrence of the infection.
What's the goal for the titer? Does it have to go to 0?
Ideally, yes. The goal is for the antigen titer to become undetectable, essentially 0. But this can take a very long time, sometimes well over a year, maybe even 2 years in some cases, even after the clinical signs have resolved. Treatment is usually continued for at least a month or 2 after signs resolve or the titer is 0.
Wow. So how long does treatment typically last overall?
It varies hugely, but owners should be prepared for a minimum of probably 4 months, and often it extends to a year or even longer.
A year or more.
Yeah. Animals with CNS involvement, the neurological form, might even require lifelong low-dose maintenance therapy to prevent relapse. Some studies showed median treatment times of around 4 months for fluconazole and closer to 8 months for itraconazole, but those are just averages.
And prevention. Is there anything owners can do to stop their pets getting it in the first place?
Unfortunately, because the organism is so widespread in the environment and soil associated with birds or certain trees, complete prevention through avoiding exposure is pretty much impossible.
Right, you can't keep your cat in a bubble.
Exactly. It's just ubiquitous.
Are there any potential long-term complications owners should be aware of, even if treatment is successful?
Yes, particularly for animals that had neurological disease. Even after the infection is cleared, they might be left with some permanent neurological deficits. Or they might have an increased risk of seizures later in life. It's something owners need to be prepared for as a possible outcome.
Okay.
But overall, the prognosis with treatment has improved a lot with modern antifungals. While it requires a significant commitment to long-term therapy and monitoring, successful outcomes, meaning resolution of the infection, are definitely achievable for many pets.
This has been incredibly informative, a really thorough deep dive into cryptococcosis. So just to recap for everyone listening, the key things to remember are that this is a pretty significant fungal infection, especially common in cats, and it comes from the environment.
Right, from soil, bird droppings, decaying wood.
The symptoms can be really varied: nasal, skin, eyes, brain, which makes getting a proper veterinary diagnosis absolutely essential. Don't just guess.
Definitely need those tests, especially the antigen test.
And treatment is often lengthy, involving months, maybe even over a year of antifungal medication and careful follow-up checks with your vet.
It's a commitment, for sure, but it often works. And remember, it's generally not something you're going to catch from your pet.
Which is good peace of mind. And I think stepping back, even if you don't have pets, it's just valuable to understand how these things in our environment can affect health, the health of wildlife, our pets, and sometimes even us in different ways.
Absolutely. It highlights those connections between environmental health and individual health.
It really makes you think, doesn't it? Considering how common these types of fungi are just out there, in the soil, in the air. What other seemingly harmless elements in our everyday surroundings might have hidden health implications for both us and our animal companions?
That's a fascinating question. Definitely food for thought. What else is out there that we interact with daily?
It's something to mull over. If you do want to explore related topics more, you could look into other fungal diseases, general pet health and immunity, or even broader concepts of environmental health. Thanks for joining us for this deep dive today.
Thanks for listening.